Hello, viewers. This is Carly Denault of WLPV News. Today's segment is on COVID 19 and how it's affecting college students. Joined with me today is community health nurse Kylie. How are you doing today, Kylie?
I'm doing great. Thanks for asking.
Alrighty, just a little recap on COVID. So, on January 9th, the World Health Organization declared COVID as a coronavirus related pneumonia in Wuhan, China. And later on February 3rd, the United States declared a public health emergency due to an outbreak in the United States. And it was finally announced a national emergency on March 13th of this year. COVID 19 is transported from person to person through respiratory droplets, with symptoms such as fever, shortness of breath, shaking with chills, headache, loss of taste and smell, skin changes, cough, muscle pain, sore throat, GI upset, diarrhea, and the most at risk people of contracting COVID 19 include the elderly, those with cancer, chronic kidney disease, those affected with COPD, asthma, pregnant women, and immunosuppressed individuals. Now, Kylie, what can you tell me about college students and the relation to COVID 19?
Well, Carly, we focused our survey primarily on the precautions that Florida Southern College of Lakeland, Florida was taking, but similar precautions to these are being taken all over the country. Colleges are currently limiting the amount of students allowed to live on their dorm rooms by close to 50%. Additionally, they're also strictly enforcing the use of masks all over campus and reducing the amount of time that students spend in large crowds by taking actions such as reducing dining options to more grab and go rather than sitting and staying and eating. They're also reducing the amount of campus events being held, and they're taking multiple precautions in regards to temperature checks when coming in and out of buildings and the deep sanitizing and cleaning of all classrooms and facilities.
Wow, that's really interesting. So, what have you focused on in your research on the effects of COVID on on the college students?
Well, as we looked into how COVID was affecting the college population, the overwhelming majority of research gathered was about the effects of mental health on the mental health of the college population. Reports have shown that college students are facing elevated levels of stress and depression associated with COVID 19, but are also finding it increasingly difficult to gain access to sources of mental health care due to the pandemic. The college student population is frequently affected by mental health disparities, but it's now facing a variety of added stressors. They are now not only worrying about their own health, but worrying about the health of their loved ones. Additionally, isolation from their peers due to the quarantine and social distance is increasing the feelings of depression and anxiety in these individuals.
Wow, I never thought about how mental health is being affected due to COVID. We always hear about the physical ailments caused by COVID, not much about the mental and emotional aspects. So, what are some preventative measures that are being taken with the college students and their mental health?
Well, first of all, we should work and try to prevent these problems from becoming any worse. My team has come up with a great intervention that we want to work on implementing in colleges all over the country. It seems that college students are often unaware of the symptoms of mental health complications, and because of that, they're not often seeking help that they need. So, my team has come up with some preventative education to implement onto college campuses. We want to inform the student population not only of the signs and symptoms of these health disparities, but ways they can go about treating them and resources they can contact with problems. We understand that college campuses often offer resources, but we thought implementing this as a first year class or a seminar would be beneficial. That way, all students are hearing the information and having access to it when they need it. As far as secondary interventions with this population, we thought that increasing the amount of mental health screenings could be beneficial, even if that's only having academic advisors and professors checking in with their students on a more regular basis. We're encouraging these faculty members to schedule Zoom meetings or starting conversations with their students to check in on how they're handling these stressful times. Lastly, we understand that even through all these measures, mental health disparities still affect college students, so we came up with a few ideas on how to help. First of all, we know that through this pandemic, isolation from peers is a growing issue, especially with students doing remote learning. So we're encouraging students to stay in contact with their peers by video chatting and phone calls. Additionally, giving students access to not only people within their college campus that they can come and receive counseling from, but also encouraging them to participate in stress relieving activities such as exercise, yoga, art, music, and even pet therapy. These interventions may not fix the problem entirely, but it's certainly going to help.
Wow, that's very interesting. So, Kylie, what future problems do you suspect will occur with this pandemic and the vulnerable population?
Well, Carly, with the pandemic progressing like it is, I feel that isolation these college students are facing will have a lasting impact. Social development and interaction is very important at this stage. According to Erickson's theory of development, this group of people are at the intimacy versus isolation phase, meaning this is a time where humans really rely on forming intimate and close relationships to further their development. Increasing isolation due to quarantine and social distancing may not only hurt these students' development, but also their self esteem by promoting feelings of inadequacy and loneliness. This is a time where they should be reaching out and forming those solid bonding and relationships. But due to the quarantine, I'm afraid that's going to be a little more difficult. And I'm afraid it may also have a lasting impact on their mental health.
Wow, thank you so much. One last question before we sign off. How would you compare this vulnerable population of college students to another vulnerable population, say like the homeless?
Well, I would say that the homeless population has very different concerns. These people are facing issues such as being exposed to elements, not having access to protective equipment such as masks, and limited access to healthcare and a greater lack of education on the subject. Whereas college students are facing more of the secondary issues related to COVID 19. The college students are likely to have access to healthcare, but they may not think that they have time to seek out care due to schoolwork and jobs. Additionally, college students are facing higher levels of depression due to a change in their social circles and lack of interaction among peers, as well as homeless population tend to utilize the emergency room as their primary mode of healthcare, which can become very expensive. And this typically leads to them not going to the emergency room unless there is a severe emergency, like a gunshot wound or a stab wound. College students, on the other hand, are usually have a primary care doctor in their home state or sometimes even in their state with their colleges that tends to be covered under some form of insurance, whether that's being paid for by the school or by their parents. But all in all, both of these populations have downsides that can affect them during this pandemic and their access to care.
Wow, that is all very informative, and I hope our viewers were able to retain some very vital information on this ever changing pandemic. Thank you so much for your time, Nurse Kylie.
Thank you for having me.
This is Carly Donald of WLPV News, signing out.